Endometrial cancer is by far the most obesity-driven cancer. Probably up to 60% or more of endometrial cancer patients are actually obese, according to the numbers. So we know that it's a very strong risk factor for the development of this disease, no question. And we also know that it may also be associated with worse outcomes for this disease, although it's a little bit controversial of whether the worst outcomes are related to actually cancer-specific outcomes or just all-cause mortality. But endometrial cancer patients, given that obesity is such a huge risk factor, have the highest comorbidity index of all cancers out there. And they actually they're actually more likely to die of actually cardiovascular disease than actually their endometrial cancer. So there's no question that obesity is a driver of the development of this disease. I think that it could potentially, obesity status may help us figure out what kind of metabolic treatments may be important in treating this disease. But I think right now we don't really treat obese and lean patients any different. But there's some research going on. I think in my lab we're trying to look and see if there are any targeted agents that may be more helpful in cancers that arise in the setting of obesity. But I think right now the data is still young, and so we just have to keep continuing to look at it and continuing to work on it. The one thing, though, to remember is that when this cancer is diagnosed in obese patients, it's also a great teaching moment to encourage them, for better eating patterns and exercise and all of those things, irregardless of cancer outcomes and all those things. Like, this is a good teaching moment to get them to improve their overall health.